Francis home. We appreciate you coming out today. This is, I think, our third annual presentation for Medicare, maybe?
Third or fourth.
Third or fourth. We've been doing this each year. I think each year we get a little bit bigger turnout, which is wonderful. We really appreciate that. I know it's confusing. A lot of people have a lot of questions, and that's why we like to offer these types of presentations here to the public and get people here to get the information they may need. So you'll notice on your tables, there's a few flyers laying around. Our next event is our Health and Wellness Extravaganza, and that is actually on Wednesday, October 12th. I know some representatives from OSHIIP will be here that day, along with many other vendors and other opportunities to gain some information from different organizations. We also that day have a featured speaker, John Bauman. He is a gentleman that is actually afflicted with Parkinson's, and he does just a really phenomenal motivational talk. So if you have an opportunity to come out and listen to John, if you want to Google him, if you want to take one of these flyers, Google him. You can see some of his speeches on YouTube. He's going to be a great addition to our Wellness Extravaganza this year. So with that, I'll introduce David Painter. David, we call him all kinds of things, whatever he prefers. And he has actually some co-workers with him today that I'm going to let you introduce, and I'm going to turn it over to him to give you your presentation today.
All right, well thank you, Leanne. Thank you guys for coming. I'm gonna do my best. I'm pretty good at being heard, but I'm particularly the couple in the far back. If my voice starts to trail, kind of give me one of these. Can you do that? Okay. As Leanne said, my name is Dave Painter. I'm here today with the Ohio Department of Insurance. My division within the Department of Insurance is called OSHIIP with a P. Important that you hit the P when you say OSHIIP. I see a lot of familiar faces out there, so I know a lot of you I've met before. Some of you are probably brand new, and as Leanne said, I brought some folks with me. So you don't have to turn around if you don't want to, but I'm going to try to point them out. We have two new staff members who started just after Labor Day. Just after Labor Day, and that's Bill and Bill and Dennis back there. And they are brand new, so all your questions to them should be softballs when we're done. Unfortunately, the hardball questions come to me and one other person I'm going to introduce, but I'm going to wait just a second on that. Also hiding out in back, and I don't know if Barb's going to hang out or she's going to take off. But she's going to take off. Barb's here with Pro Seniors, and I'll talk a little bit at the end of my talk about Pro Seniors and what they do. They're another organization that partners with us. But let me tell you a little bit about OSHIIP. As I said, we're part of the Ohio Department of Insurance. We are one of 54 similar programs in the United States. All 50 states, all 4 U.S. territories have a SHIP program. And we are all given the same mission, which is to provide Medicare information to you, the consumers. We do it in a number of different ways. We have publications, like this white book. Did everyone get a white book? Yes? Anyone not get one? Shoot your hand up and one of the fellows will bring you one. No? Okay, excellent. And a number of other publications that we put out just to help folks learn more about Medicare and more about resources. We have speakers like myself who go out and do these presentations. However, full-time staff, there are 5 of us. 5 of us for all 88 counties of Ohio, 5 of us for 2.2 million people in Ohio on Medicare, and every month we add 10 to 15,000 new people to Medicare for the first time, just in Ohio. Not talking nationally, just here in Ohio. So I'm supposed to reach about 350, 400,000 people a year. I'll be the first to admit I don't do that. I fall short of that goal. So what we do instead is we actually train local people to be volunteers. They go through an initial training. There's 2 different ways to do it now. There's the in-person 5-week training. There's an online training. And the reason I mention that is we have volunteers all over the state of Ohio. I'm going to mention a lot of things that OSHIIP can help you out with. OSHIIP can help out with, and if you don't want to deal with us out of Columbus, there are people in the community. One of my volunteers, who's actually not from Tiffin, is in town for another reason, and she emailed me yesterday and said, hey, I might stop by. And I said, absolutely. So Janice is back here. Wave, Janice. She can take hardball questions when I'm done. Softball questions for Dennis and Bill, hard questions for Janice. You guys got that? But Janice, how long have you been a volunteer? Like 3 years?
About 3 years.
4 years, something like that? Yeah.
It's
And
3 good years.
yeah, absolutely, absolutely. So we have the volunteers. What's the last things I want to say? You know what? And I have one of an older one. You have a new one. Good. Why do I have an old one? Okay, everyone looks like they have a new one. That's okay. When we just reprinted these, and the website and 800 number could not be smaller on the front cover. They could not have printed that any smaller. I see you guys smiling. I'm going to give it back to you. Don't worry. It is on the back though. Our website, insurance.ohio.gov. That is the website for the entire Department of Insurance. If you are someone who uses the internet, but at the very top there are buttons, and one of them says Medicare Services. If you click on that, that will take you to our page. Then there's the 800 number, at 1-800-686-1578. And actually, you know what? I am going to do the old one. How about that? Okay. Well, no, I got an old one. What are we doing? Why do we keep exchanging this stuff? I got the one I'm looking for. 1578. Our hotline is staffed 7:30 to 5 Monday through Friday. Rings into downtown Columbus. There's actual human beings on the other end of the phone who live in the same state you do and speak the same language that you do. They are there to help you out with any questions you are having regarding your Medicare, regarding the different products, your Part D plans, your supplemental plans, whatever it is. Anything from a very simple question all the way to I want to actually compare my drug plans, I want to compare my Advantage plans, I want to make a change, whatever that is, we're there to help out with. No one, OSHIIP staff or volunteers, has anything to sell, promote, or endorse to you. Okay, there's a lot of folks who are out there to help you figure out Medicare. Most of them at the end of the day, however, do have something to sell. We don't. We're state employees. We are funded to help the consumer. That's the commercial. I'm going to stop right there. No more commercial. We're not going to hit every page in this book, but we're going to hit a lot of them. This first slide is going to look a lot like page 3 inside this book. So if you just open the front cover, it's going to get you where we are. And I guess I am going to steal it from you because now I got an old book that don't have the right page number. You would think I would have planned this out. No, I got it, Kelly. I got it.
Well, does she need one now?
She's got it.
Okay.
This is the first time I've ever done this.
You're starting to worry me.
I know. I've only been doing this talk for like 5 or 6 years. I haven't quite got it down yet. All right. It's up to them.
Is that better?
Yes.
Okay. All the way dark? Okay. Page 3 is going to say, what is Medicare? Most of us know federal health insurance, right? 3 groups of people qualify. 65 and older. Most common group, that's what we tend to think of, right? 65 and older. However, you can qualify for Medicare at any age if you are disabled. What do we mean by disabled? I mean if you qualify for Social Security disability or disability through the Railroad Retirement Board. After 2 years of being qualifying for disability, you will be automatically enrolled in Medicare regardless of how old you are. The other one is a weird little rule that you're going to see twice. Any age and diagnosed with end-stage renal disease. End-stage renal disease is permanent kidney failure. You're going to see that pop up one more time before I'm done. Just one of those weird rules that just makes, our government so much fun, right? Then there's this graph, and this is on page 3 as well. It's option 1, option 2. Everybody on Medicare, no exceptions, falls into one of those 2 categories. There's no exceptions to that rule. You're either over here in option 1, original Medicare A and B, you may or may not have some sort of secondary coverage. Hopefully you have some sort of Part D plan, and we're going to talk about that today. Or you're over here in this option 2, which is Medicare Advantage. Most of what we're going to talk about today are going to be these individual parts. What they are, how they work, how they don't work, or how they don't work together in some cases. Because what's coming up? Medicare's open enrollment period. October 15th to December 7th. Starting October 1st, the plans are able to market to you. Meaning, every time you go to your mailbox, starting October 1, you're going to have a ton of ads in there. These are the kind of things that they're going to be trying to sell you. So if nothing else, let's try to get an understanding of what it is they're trying to sell you, and then I'm going to give you some resources to help you figure it all out. Sound good? All right. I got a big crowd, so we're not going to get lucky this time, guys. Show of hands, who's not yet on Medicare? I knew it. Every once in a while we get lucky, you know, and it's. But looking at this crowd, I'm like, no, we're not going to be that lucky. Okay, applying for Medicare. This is on page 4. Still 65. Like, full Social Security age for most of us has crept up somewhat. Medicare has not. It's still 65. You're still eligible to sign up for Medicare at age 65 if you so choose. When to sign up, there's a 7-month initial enrollment period. It's the 3 months before you turn 65, the month you turn 65, and the 3 months after. 7 months in there. Strongly, strongly, strongly recommend the 3 months before for 2 reasons. Number 1, Medicare goes month to month. So if today was my 65th birthday, and today's September 20th, but I had signed up beforehand, my Medicare would have started September 1. Even though I wasn't quite 65 yet, it would have kicked in September 1st. The real reason to sign up early, not that this has ever happened before, but let's say the government makes a mistake. If they send you your card and something's wrong on it, the number's wrong, your name's wrong, whatever it is, you want to have a little time to fix it before the first time you use it. You can still use it, but you're probably going to have a paperwork headache on the back end of that, right? So that's a good idea. How do I sign up? It's through the Social Security office, or I should say through the Social Security Administration. You can do it 3 different ways. You can do it in person at the Social Security office. Go in, fill it out, in person. You can do it online at ssa.gov, or you can do it on their automated hotline, and that's down here as well, that 800-772-1213. And again, that's automated. You're not actually talking to a human there. You're saying, they'll say type in your Social Security number, and you'll punch that in, and then they'll say, we think you punched in, is that right? Yes. You're going to be on the phone for a little while, but that is another way to do it. We're going to talk a little bit about one more thing about enrollment, but I'm going to hold off for now. I'm going to hold off for right now. This was in the big box there, but I want to hit it here in a second. All right. Oh, you know what? I did forget to say something. If at age 65, you are already getting any sort of benefit from Social Security, meaning I took early Social Security on my own work record, on my spouse, widowers, disability. If Social Security is sending me a check, they're going to automatically sign me up for A and B. I'm automatically getting signed up for A and B. I don't have to actively go and sign up for it. My card's just going to show up in the mail one day. It's just going to show up that, hey, I'm signed up for A and B. If I'm already getting that. I'm sorry, I almost forgot all about that one. Okay, so the next few pages, 5 and 6, we're going to kind of summarize them here on this one slide. Kind of summarize them on one slide here. A and B. So there's a Medicare card, right? Red, white, and blue. The red's almost cut off, but red, white, and blue. Medicare card. Original Medicare. For some folks, that's all they have. For right now, that's where we're going to start. If I just take A and B and nothing else. A and B is your hospital and your medical. So your Part A says hospital, right? You can think of Part A as inpatient stuff. Inpatient stuff. So inpatient in the hospital. Inpatient in a skilled nursing, a rehab, something like that. Home health care, now we're talking about skilled care in the home. And hospice care. Hospice is specialized end-of-life care. All is going to be covered under Part A. Part B is your medical. You could also think of it as your outpatient stuff. So it says outpatient services. What they're talking about there, anything I'm doing at the hospital that I'm not being admitted for. So the emergency room, the outpatient surgery, tests, x-rays, whatever it is. If I'm doing it at the hospital but I'm not being admitted, it's being billed to Part B. Doctors, my doctors are paid under Part B, doctors, providers, preventative benefits. We actually have a whole page on them about preventative benefits there on page 7. And durable medical equipment. So what's durable medical equipment? Walkers, wheelchairs, oxygen, diabetic testing supplies, CPAP machines, things like that we sometimes need to keep us going, is all covered under your Medicare Part B. Real quick, I'm actually going to skip the preventative benefits, and I want to jump all the way to page 8. Now, you're looking at the top of page 8, and you say, Dave, that says 2016. I didn't come here to hear about 2016. I came here to hear about 2017. Why does it not have 2017 amounts up there? Because they have not been announced yet. Haven't been announced. When do I think they'll be announced? I shouldn't say this is too big a group to make this joke. I'll do it anyway. It's going to be on YouTube. Just get me fired. When do I think they will announce it? Does anybody have a guess there?
Not until they absolutely have to.
December 31st.
No, not December 31st.
After the election.
Say it again.
After the election.
Okay, they said it. Say it much louder so everyone hears you.
After the election.
There you go. More than likely. More than likely it won't be until November. I'll put it that way. Probably won't be until November. So we kind of got to go by what we know now. Go by what we know now. Let's talk about Part A first. For most Americans, better than 99% of us get our Part A premium free. Part A is premium free for most Americans. How did you get a Part free? I'm sorry, how did you get Part A premium free? Either you worked 10 years throughout your entire life. Doesn't have to be consecutive, but throughout your life, you worked 10 years, had Medicare taxes taken out of your check. Or you had a spouse who worked 10 years throughout their entire life, and they had Medicare taxes taken out of their check, and you don't still have to be married to that spouse, but you had to have been married for at least 10 years. 10's the magic number. Either I worked 10 years, I had a spouse who worked 10 years, and if that's not still my spouse, we had to have been married for at least 10. And I should also mention it has to be your legal spouse. I ran into that 2 weeks ago. You also have to be legally married. If that's the case, your Part A is premium free. As I said, that's better than 99% of Americans. If you think you're in the 1%, talk to me, when you're done, we'll talk about it, but most folks get that premium free. Hospital deductible. Now remember, at this point, I'm just talking about A and B. I'm not talking about if I have a supplemental plan or I have an advantage plan. I just have A and B. I'm admitted into the hospital. I would owe that deductible. $1,288. Would cover me up to 60 days inpatient in the hospital. If I'm there longer than 60 days, there are some big co-pays you see down there below that. But let's be real, who's in the hospital for 60 days? Almost nobody. Almost never. Usually the case is you're going to be in the hospital for a few days. If you're not able to go home, that's when you go to skilled nursing. Sound right? Can't be sent home, I have to go to skilled care. Now, under original Medicare rules, Advantage plans are a little different, but under original Medicare rules, for Medicare to pay for that skilled nursing stay, I need to be in the hospital for 3 days, 3 overnights in the hospital. Used to be an easy thing to keep track of. If you've been in the hospital for 3 days, you've been in the hospital 3 days. Now they have something called observation status. Observation stays. What that means is I'm in the hospital, I have spent the night, maybe I've spent a couple of nights, but according to the hospital, I'm still an outpatient. I haven't been admitted yet. Is Medicare covering me? Yes. My Part B is covering me under outpatient services. However, those nights that I'm there as an outpatient don't count towards the 3 I need for the skilled nursing. I have to be an inpatient. We don't have a whole lot of power there as individuals. We can't, force a doctor to admit us to the hospital as an inpatient. It is important, very important to know your status. How do you find out? You usually got to ask. Now, hospitals are getting better, and some are quite good about it, but you usually need to ask. Hey, am I an inpatient or am I outpatient? Am I an observation? When did I, did I come in an observation and transition? What am I? Find out. Once you've found out, then it's time to educate your doctors. And say, hey, by the way, I need my 3 nights if you want me to go to skilled nursing and I can't go home from here. My wife can't drag me around the house once I get home, right? Right now, it's a good idea to talk to your loved ones about this rule, because if you're the one in the hospital, you might be in no shape to be thinking about, am I an inpatient or an outpatient, depending on what's going on. So we kind of have to be our own advocates here, unfortunately. We kind of have to be our own advocates. Let's say best case scenario, got my 3 days in the hospital, I'm going to skilled nursing. First 20 days, I don't pay anything. Starting at day 21, I have a daily copay of $161 a day for days 21 through 100. Very short version of Part A. Part B. Now you see two premiums up here. I should say Part A was premium free for most people, right? Part B is not premium free for most people. Most of you pay a premium for Part B, right? Monthly premium, a lot of folks have it deducted from their Social Security. There's two amounts up here. So let's talk about it. We'll talk about the smaller amount first. That $104.90, because your book's going to have that one first, actually, that $104.90. If you were on Medicare in 2015, you signed up in 2015, and your Part B premium was deducted from your Social Security. Those two things have to be true. 2015, I was already on Medicare Part B, and my premium was taken out of my Social Security. If that's the case, you're paying $104.90. Didn't go up. That was what the premium was in 15. If that was the case for you, it didn't go up. For everybody else, like everyone who raised their hand when I said, is anyone not yet on Medicare? Everybody new in 2016, or if you didn't have your Part B premium taken out of Social Security, there's a higher amount, $121.80. So why is that? Last year, there was no increase in Social Security. They didn't give everybody a raise. If they don't give you a raise and your Part B premium comes out of your Social Security, they can't raise your Part B premium. They can't take it in one hand if they don't give it to you in the other. That's another way to look at it. But for everybody else who's new, too bad, you have a higher amount. So what's going to happen next year? I don't know. We don't know yet for 2017. That's the big number we're all waiting on, right? What's going to happen to the Part B premium? If they announce officially that that there's an increase in Social Security, something will happen with that premium almost guaranteed. Now, if they announce they're going to increase Social Security, they will do that before. Say it again, really loud. Before. Yeah. Before we go vote, they'll let you know if you're getting a raise. Then after you vote, they'll say, oh, by the way, we're taking some more away over here, right? Yeah. So there's your Part B premium. I'm going to say most folks pay that. There's this penalty. That's what I want to talk about. So let's say, because I got a lot of young people here today. Let's say you're turning 65 and you say, you know what, I'm going to take my Part A because I already paid for it. Why would I take something I already paid for, right? I'm not going to take my Part B because I don't go to the doctor, very often or if at all. Why would I bother paying that much money for something? I'm just not going to take it. Here's why. Every year, every 12-month period that you're eligible for Part B and haven't taken it, you're going to get a 10% penalty when you later sign up. So if I wait till I'm 66, I'm going to get a 10% penalty tacked on that Part B every month for the rest of my life. If I wait till I'm 70, I'm going to get a 50% penalty tacked on every month for the rest of my life. There is one way, and one way only, to not sign up for Part B and not get that penalty. That is if you are still working, still employed, and you have health insurance through your current employer, or you have a spouse who is still employed, and you have health insurance through their employer. Has to be current employment. Cannot be any sort of retirement plan or anything like that. Either I'm getting up and going to work, or my wife is getting up and going to work, and whoever that is, if that's who my health insurance is from, then I don't have to sign up for Part B. And later on down the road, when I retire or my wife retires, whatever the case is, I can go sign up for Part B and I don't get any sort of penalty. Because that whole time I had what was called creditable coverage. But that's it. That's the only way to avoid that penalty. If you're retired, you need your Part B. You need your Part B. Annual deductible. So you're paying your premium every month. There's still a deductible, and this year it's $166. So the first $166 is on you. And once you've met that deductible, your Part B is an 80-20. Medicare is paying 80%. You're left with that remaining 20%. All right. So page 9 talks about the Medicare savings programs. These are three low income programs for some folks who qualify for them. There's three different ones available. It's a QMB, the SLMB, and the QI. The QMB pays your Part B premium. So that Part B deductible no longer comes out of your check. You no longer owe it. It also works as a free supplemental plan, which we'll talk about supplemental plans here in a second. The other two, the SLMB and the QI, also both pay that Part B premium. Again, they are low income, low resource. I'm going to talk at another point what all this income and resource means, so I'm going to keep going. But if you think you might qualify, for one of the income assistance programs, give us a call. Don't wait on it, do it today, okay? It's an application, you would mail it in to the county job and family. So if you live in Seneca County, it would go to Seneca County job and family, and you will get a letter back saying you got it or you didn't. If they needed more information, they would call you. At no point are they ever gonna make you come in person. For a lot of people, they're like, oh, they hear job and family, and like, I don't wanna deal with them. You don't have to necessarily deal with them. You don't have to go in. But it's worth giving us a call if you think you might qualify. All right, so, first piece of the puzzle then, and that's by far what takes the longest here. So we looked at A and B, and we saw there were a lot of deductibles. There's hospital deductibles, there's the deductible for Part B, there's the 20% co-insurance, there's the daily co-pays after so long. A lot of money, right? A lot of folks just pay. They say, you know what, I'm just gonna have my A and B, and I'm just gonna pick up all that on my own. I'm gonna save my money for a rainy day, and when I need it, I'm gonna have it. Other people want something to fill in those gaps that original Medicare doesn't cover. And this is where the second part of this option one comes from. First one's group health insurance. That's if you're fortunate enough that you or your spouse work somewhere that continues to offer you insurance benefits that supplement Medicare after you turn 65. If you have that, consider yourself lucky. That's becoming an endangered species for sure. Definitely becoming an endangered species. Still out there though. Still out there for some folks. The second one, there's Medicaid, and that's kind of what we just touched on with the Medicare savings plans. But there is also what's called full Medicaid, where Medicare is my primary and Medicaid comes in as a secondary insurance. And again, that's state assistance for people under certain income guidelines. The third way to do that is what we're going to spend a couple minutes on, which is called Medicare supplemental insurance. And that's what you got there on pages 10 and 11, talking all about the Medicare supplemental insurance. Medicare supplemental insurance, also called a Med Sup, also called a Medigap. It is three terms for what is literally the exact same thing, just to make Medicare more confusing. What this is a private policy. So we're not talking about the government anymore. This is a private insurance company selling a private policy. If you choose to buy a Medigap, Med Sup plan, you're paying them a premium every month, and in exchange for that premium, they're coming in after Medicare and picking up most or all of what Medicare didn't pay. So a lot of these plans are fully comprehensive. They pick up all those deductibles, all that 20% copay, they pay all of it. You probably figured out that doesn't come cheap, right? All right, state average. Now, a lot of you guys shot your hands up when I said, you know, who's not 65. So you're on the low side of this. A state average is about $200 a month, but keep in mind that takes into account the 65-year-olds and the 100-year-olds. Most of you, when I said who's not on Medicare yet and shot up your hands, you're going to be on the lower side of that, you know. But it is out there. That is sort of the premium. They're not cheap, but you'll see here on the page it says they are standardized. Here's what standardized means. Forget the A and B we've been talking about so far. They're sold by letter name. A, B, C, D, F, G, K, L, M, and N. A, B, C, D, F, G, K, L, M, and N. Standardized meaning this. I'm going to use Plan F as an example. All Plan Fs are the same. Cover the same thing at the same rate, regardless of what company I bought it from. It doesn't matter what company I purchased it from, it's all going to be the same. All Plan Gs, for example, are exactly the same. Cover the same thing at the same rate, doesn't matter who I purchased it from, and so on and so forth. All Plan Ns, exactly the same. So each letter name is going to be exactly the same thing. So if it's an F, I know all Fs are the same. I know all Gs are the same. All Ns are the same, regardless of what company I purchased it from, with one exception: what it costs. The premium that it costs. I can go to two different Plan Fs. Two different insurance companies are going to quote me a different premium on that. Why? Because they're private companies. It's the first thing I said, right? They're private companies. They have to charge what they feel is a fair price. I'll all the time compare it to the car dealer and say you can go to 2 different Ford dealers, you can look at the same car, all the same bells and whistles, depending on what dealership you're at, you're gonna pay a different price for that car, right? These insurance companies are the same thing. All the same bells and whistles, same thing, but depending on what company I'm going to, they're gonna quote me a different premium. And the reason I like to say that is this is the one type of product that OSHIIP staff and OSHIIP volunteers cannot enroll you in, because they're 100% private. Got to go through the company or go through an agent, one of the two. Either go through the company or the agent. So what we can do though is look at this, nice little chart on page 11, which I'm not going to go all the way through it, so don't even feel like you need to turn there. We can go through that. We can tell you what all that means. We can tell you what a Plan F covers. We can tell you what a Plan, M covers, whatever it is. We even have a book, and I keep picking on you, and I apologize, that I think Dennis was giving out to folks as they came in, because most of you look like you got them. Even has a list of the companies that sell them, has some sample premiums. We can get you that far. We can't actually sell them to you, though. We can't actually sign you up for one. Our advice would be to shop around. So if I look at this, and I talk to an OSHIIP volunteer or the hotline, and I know I want a Plan F. Everything on Plan F says 100%. Boy, that's fully comprehensive. I know that's what I want, right? Then we're going to say look at least 3 to 5 different companies. At least 3 to 5. Why? Because if the difference is in premium is $10 a month, doesn't seem like much, but if I keep that plan for 30 years, $10 a month is a heck of a lot of savings, right? It's a heck of a lot of money. So it's definitely worth shopping around. Definitely worth shopping around. Nice thing about these plans, there's no network. I don't have to worry about is this doctor, is this hospital a network. Anyone who accepts Medicare, which is still better than 96% of the doctors in this country, are going to accept my supplement plan. Most of them even pay for care overseas, even outside of the country. They pay after original Medicare, and then this is guaranteed issue period. We got to spend a minute here because again, we got a lot of young people in the crowd today. For the first 6 months that these 2 things are true, you are at least 65 years old, and you have started your Part B. For 6 months, you have what's called a guaranteed issue. Now let me say that again. You have to have started your Part B and be at least 65 years old. So if you're one of those people who's still working, you're like, I'm not going to retire until I'm 68, so I'm not going to take my Part B till I'm 68. It would start when you actually take your Part B. Or, we'll go the other way. If I'm on disability, I have my A and B, I've had it since I was 45, right? When I turn 65, I'm going to have those 6 months once I turn 65. Because those 2 things have to be true. I'm at least 65 and I have Part B. For 6 months, you can sign up for any supplement plan, any Medigap sold in the state of Ohio. They have to accept you as a client, and they can't ask you any health questions for 6 months. Sign up for whatever you want. Have to accept you, can't ask any health questions. After those 6 months have come and gone, you can still apply for any plan at any time. There's no open enrollment for Medicare supplement. It's year-round. You can apply at any time. Now, however, they are going to do what's called medical underwriting. They're going to ask a bunch of health questions. They're going to know your history. And based on your health history, they have the right to say, no thanks, we don't want you as a client. Or they can say, we're going to take you on as a client, but based on your health history, we are going to adjust your premiums. And they only adjust premiums in one direction, right? So my point is, it's worth it. If it's something you're interested in, get educated on it before you turn 65, and let's take a look at it. Get educated before you turn 65, and let's take a look. All right, 2 pieces of the puzzle down. Original Medicare, A and B. Secondary insurance, some folks have it, some folks have none. The 3rd piece of the puzzle, if I'm going with original Medicare, is option 1, is Medicare Part D. And Part D is your drugs, prescription drug coverage. Starts on page 12 there. So everybody with Medicare can sign up for any Medicare drug plan sold in Ohio. Every plan sold in Ohio. Doesn't matter, as long as you have any type of Medicare, you can sign up. They are, again, private companies, but they are under contract with Medicare. They sign 1-year contracts with Medicare, so if you sign up, they have to take you. They have to take you. Every year, you have the opportunity to change that drug plan. The Medicare open enrollment is October 5th to December 7th. That's the time of the year where you can look at that drug plan, see if it's the best one for you. If it's not, pick a new one. Absolutely, it's the time to do that. And people don't like to hear this, but we strongly recommend that everyone look at their drug plan every year because they change. The premiums change, the co-pays change, the drugs they cover change. And we see that every year where someone will call us in January and say, boy, I don't know what's going on. I went to the pharmacy and they told me it was $400. I about passed out. It's like, well, probably because something you were taking is not being covered by your plan anymore. And guess what? January is too late to do anything about it. October 15th to December 7th. So how do I compare these drug plans? And I should also tell you, this year there's 24 to choose from. The year before that, there were 36. So we'll probably be somewhere between 25 and 35 for next year, I'm guessing. We won't know until October 1st. How the heck are you supposed to figure that out? That's where we come in. That's where we come in. Give us a call. Call us on that 800 number, 686-1578, and ask for one of two things. Say, I want to compare my drug plan. I'll do it right now with you on the phone. You can mail me some stuff to look at, and we'll figure it out that way. Or you can say, I want to try to find a local volunteer. I want to find someone that I can meet up and sit with. Regardless, we will help you out. We're going to ask for the same thing. We're going to ask for the information on your Medicare card. That's how we look you up in Medicare system. Okay, we're not putting anything in there that's not already in there. That's how we look you up. And then we would ask for a list of your prescriptions. Here's my prescriptions. Here's how often I take them. Here's my dosage. We're going to put those in Medicare system, and it's going to take those. Let's say we have 25 plans next year. I'm just making that up because I don't know yet. Let's say we have 25 plans next year. It will rank them 1 to 25 for you individually. Here's the least expensive plan to cover all of your drugs. Here's the second least expensive, the third. If you have a Part D plan right now, it will compare it to the one you have right now as well. And we can tell if there's a less expensive option out there than what you got right now. If something's not going to be covered by your plan, it tells us that in big bold letters. Not on formulary in 2017. And we can say, hey, by the way, did you know your insulin's not going to be covered by your plan next year? Very important stuff. We can tell you in black and white, this plan is going to cost this much, this plan is going to cost this much, they're both going to do the same thing. What we can't do, either staff or volunteers, is pick for you. We can't make that choice for you, okay? A lot of times, as I said, it's in black and white, and it's very easy to figure it out. If one costs this much and one costs this much, and it does the same thing, go for the cheap one, right? But we can't tell you that. Now, if you're talking on the phone, if you're with me, if you're talking with Janice, somebody, and we're trying to tell you the same thing over and over and over and over and over again, we're probably trying to get you to hear something that we can't tell you. But it does happen, Sometimes we really have to be like, money in your pocket. One time I actually got out my billfold and I'm like, it's like I took this money and threw it away. But you have to actually say, yeah, you're right, I should switch. Absolutely worth looking at every single year. The bottom of page 13 talks about the extra help. Bottom of 13 talks about the extra help. What this is another low income program. If you qualify for it, you can get a Part D plan at low or no premium, low or no deductible, very small co-pays and no donut hole. We're going to talk about donut hole in a minute. I'm going to talk about these resource levels though, because they probably make more sense. I'm just going to go, in the interest of time, I'm just going to pretend like we're all single, okay? A little bit higher for the married, but single person can make up to $1,505 a month and have total resources of up to $13,640. So what are we talking about? Income is your gross income. So Social Security, pension, wages if you're working, whatever that is. Before anything comes out, before the Part B comes out or anything like that, your gross has to be that or lower. 1,505 or lower. Resources, 13,640. Resources are like money in the bank, meaning checking, savings, and any sort of investment you have. Any sort of investment money you have. What doesn't count as a resource is your home, as long as you or your spouse live there. So as long as you live in your home, it doesn't count as a resource. Property other than your home would count, or if you don't live there anymore. Every once in a while, we'll find someone who's, you know, I've moved to an assisted living or a senior apartment somewhere and they still have their house in town. Now that's gonna count as a resource. Now that's gonna count as a resource. What's inside of your home doesn't count as a resource, your vehicle doesn't count as a resource. If you're looking at this and thinking, boy, you know, I might qualify for this, or maybe I qualify for that other low income, please don't hesitate to call us. These programs take a couple months to kick in, so it's good to get the ball rolling. I will say you have nothing at all to lose by applying for it. You know, if you apply and don't get it, your name doesn't go on any lists anywhere, anything like that. This is the federal government, they already got you. They got your name already, right? So you have nothing to lose by applying. If you're looking at it and saying, you know, I don't qualify for this, but I know someone who probably does. You know, I have someone in my family or in my community who might qualify for it. Give them our number, pick up an extra book or something, you know, get them to get a hold of us and let's take advantage of it. Let's save some money, right? We do know that that is a program that more people qualify for than take advantage of in the state of Ohio. We just have no way of identifying those people. So you gotta call us. All right, turn to page 14 for me. Part D costs. This is updated for next year. All of these standalone drug plans have a monthly premium. The average, again, I don't like averages because it takes the low and the high and comes up with an average. If I was to take this year's prices, I think the lowest one this year is $18.60 a month, and the highest one was $125. And that's how we came up with, you know, the median price. And now next year the median price is up to $34. I would imagine most of them are going to be in somewhere in the $29, $30 range. There'll be a couple cheaper and a few more expensive than that. Annual deductible. If your plan has an annual deductible, it can charge up to $400. So depending on how they work that out, the first $400 might be on you before the plan kicks in. Once your plan kicks in, whether or not you have a deductible, how it's going to work is the plan's going to pay the majority, and you're going to have a copay. You're going to have a copay, you know, on all your drugs, but the plan's going to pay the majority of that. Pretty straightforward so far, right? Here's where we throw a monkey wrench into it. I'm on page 14, fourth bullet point, in case you're someone who likes to underline amounts. It says coverage gap, and in parentheses says the donut hole. It's the only time in your life the donut hole is a bad thing. This is a bad thing. What this is when your total prescription costs, meaning what you paid for all of your prescriptions and what your plan paid for all of your prescriptions in a calendar year, reaches this first amount, $3,700 between January and December. You hit that amount, you're in the donut hole. You have your Part D plan, it's not working like it was before. You're going to stay in the donut hole until one of two things happens. Either January 1 rolls around, because once we hit January, you're back to having spent zero. It's a new year. You're back to having spent zero, you're out of the donut hole. Or if you're real unlucky, you've gone all the way through and spent $7,425. Once you hit that amount, you pop back out this other side. You've gone all the way through this donut hole and to the other side. You're in what's called catastrophic coverage. In catastrophic coverage, your copays are very low. They're about 5%. Why? Because you spent a heck of a lot of money to get there, right? Now, that's all the bad news. You guys got very quiet when I talked about that. So, the good news is the donut hole is going away. It's going away, but it's still going to take us 3 more years. 2020. The year 2020, there will be no more donut hole. In the meantime, what they're doing is they're throwing in discounts for folks who are in the donut hole. So for next year, if you find yourself in the donut hole, any name brand drug you buy while you're there, you'll get a 60% discount on, so you'll pay 40%. Any generic drug, you'll get a 49% discount on, so you'll pay just over half. These discounts are going to be a little bigger over the next couple of years. Every year it's going to be a bigger discount until finally 3 years from now in 2020, it's gone. We don't have to worry about it anymore. Last thing I want to say about Part D. Again, we meet a lot of people every fall who say, you know what, I don't have a drug plan, I don't need it. I don't need it because I don't take anything. You know, or I take a couple generic drugs and I can afford it. So why would I bother signing up for one of these drug plans? Well, there's 2 reasons why you need it. The first one is, remember we talked about Part B and I said you didn't sign up, there was a penalty? Guess what? Part D has one too. It's a 1% penalty for every month. So it's 12% a year if you later sign up. You get that penalty tacked on to your Part D costs. There are a lot of ways to avoid that. If you have any other type of drug coverage that can tell you in writing it is credible coverage to Medicare, don't remember that. Remember, it meets or exceeds Medicare standards. That counts as a Part D plan. Most retirement plans that have drug coverage qualify as a Part D. Veterans, if you qualify for prescription benefits through the VA, that counts as a Part D. If you're retired military, spouse of retired military, TRICARE counts as a Part D. Retired federal employees, their plan counts as a Part D. There's a lot of things that count as a Part D. But if you have no other drug coverage, you're subject to that penalty. But here's the real reason why you need it. Because that open enrollment is the only time you can sign up. So let's say you let that come and go. I didn't sign up. Now those of you who are turning 65 in the next year or so, you'll have your initial enrollment. But I mean, every year there's this open enrollment. So let's say you don't sign up for a drug plan. Open enrollment comes and goes. January rolls around, I go to the doctor. They say, you know, Dave, I got some bad news for you. You have fill in the blank and I'm gonna start you on this and this and this. I can't go pick up a drug plan then. Can't do it. I have to wait till the next open enrollment in October, and it's not gonna start until the next January. So what do you do in the meantime? Well, you either don't take the drug or you pay for it out of pocket. Neither one's a very good option, and in some cases, neither one might be an option. So it's important to have that drug plan. Now, having said that, there's still somebody in this room who's not gonna pick one up this year. Guaranteed. Guaranteed. I always use my father-in-law as an example, and I shouldn't pick on him. Because he was lucky. He had a retirement plan that paid for his drugs, but he used to brag that he was 66 years old and didn't take any prescriptions. People can't believe it. Everyone I talk to, they can't believe I'm 66 years old and didn't take any prescriptions. He hadn't been to the doctor in 30 years. Okay? And then he had a heart attack, and now he's on everything. You know, he's on blood thinners, he's on cholesterol, blood pressure, diabetes medication now, and he's on everything under the sun. But we all know people like that, you know, right? Healthy as a horse. Yeah, you're healthy as a horse because no one's ever checked you out, you know? And she keeps looking at her husband every time I said that. Not to rat anybody out. Keep turning and looking at him, so. All right, all the way through option one. Now those of you who've never heard this before, we're almost there. Some of you are thinking, oh my gosh, is he only halfway through this? No, we're almost done. Hang in there. Option one, a lot of folks are gonna go with that original Medicare, maybe not some sort of secondary coverage, and Part D. A lot of you can go to this option two, which is Medicare Advantage, and that's what we have on 16 and 17. So what is a Medicare Advantage plan? It's sort of an all-in-one package. So it's your hospital, your medical, your drug plan, all wrapped up into one package. It's again a private company under contract with Medicare. So they have to accept you provided you meet these three conditions. You're enrolled in both A and B. You have to have both parts of Medicare, both Medicare Part A and Medicare Part B. Live within that plan service area. Here in Ohio, it goes county by county. So the plans I can sign up for if I live in Seneca County aren't necessarily the same ones I can sign up for if I live in Wood County, even though, you know, it's gonna depend on where I live. Does not mean your doctors and hospitals are limited to where you live. Okay, I could have doctors in Toledo, I could have doctors in Columbus, but the plan I can sign up for is based on the county in Ohio which I live in. So, and there's no age or medical restrictions except for end-stage renal disease. Remember when I first started, I said if you had that permanent kidney failure, you could sign up for Medicare prior to 65. That's where they gave us something, where they took it away, is they said, however, those folks can't sign up for Medicare Advantage. Everybody else can. Everybody else can. Weird little asterisk in the rules there for whatever reason. So think of Advantage as an alternative to original Medicare. Meaning, if I have an Advantage plan, I'm not using my original Medicare anymore. I still have it, I still have the rights and protection, but my Advantage plan is handling all my medical. So you don't even carry that red, white, and blue card to the doctor with you anymore. Okay? Leave it at home. And I'm gonna use my Medicare Advantage whenever I go to the doctor, whenever I go to the hospital, skilled nursing, pharmacy, whatever it is, I'm using Advantage. Two options available in most of the states are the HMO and PPO. And they are about on page 14, not quite halfway down the page. The HMO, Health Maintenance Organization, I'm sorry, did I say 14? 16. Threw everybody off, didn't I? 16, about halfway down the page. In the old book, it was 14, just FYI. An HMO means I have a network of doctors and hospitals that I have to use. Gotta stay in network or you're not covered. The PPO, Preferred Provider Organization, means I have a network of doctors and hospitals. It's less expensive if I always stay in network. But I can go outside of network, see any doctor who will accept it, any hospital who will accept it. I'm just gonna have a little bit higher pay, higher copay. It's gonna cost me a little more to go out of network, but I'm still have coverage. So the HMO, I'm more limited. Gotta stay in network or I'm not covered. The PPO, more open. I can go outside, but I'm gonna pay just a little bit more. Most of these drug plans most of these Advantage plans have a Part D, have a drug plan wrapped up in them. So I don't have an Advantage plan and a Part D, it's an all-in-one package. It's an all-in-one package. Some of these plans actually have no premium at all. No premium at all. How does that work? Well, you're paying your Part B premium still, and if you have Advantage, they're getting most of that premium. So I'm paying it to Medicare. Medicare's taking it and paying it to my Advantage plan if I have Advantage. Because some of the ads you guys are going to start getting are going to say, we have 0 premium plans available. You're like, how the heck is that possible, right? How the heck do they have a 0 premium plan? They're still getting paid, and they're still getting paid by you. What they're saying is we don't have a premium on top of the Part B premium. And that's usually an HMO. There are some PPOs out there that still have premiums on top of them. I should say most of them still have a premium on top of them. In general, they're a lot less expensive than the supplement plan. You know, a premium might be $50, $60, something like that. So it's a lot less expensive, right? The difference being how the two plans are going to work. The big difference here is I said that supplement plan, you pay a lot of money up front, and it's picking up a Medicare Advantage, right? With this Advantage, I'm paying less money up front, but I'm going to have co-pays as I use medical services. So every time I go to the doctor, I'm going to have a certain copay. I have a higher copay at the specialist, a copay when I go to the doctor, a copay when I go to the hospital, the skilled nursing. I'm going to sort of pay as I use it. Less expensive up front, but I'm going to pay as I go. That same open enrollment, October 15th to December 7th. Just like it's the open enrollment for the Medicare Part D, is the open enrollment for the Medicare Advantage. Just as OSHIIP staff and OSHIIP volunteers can help you sort out the Part D plans, we can help with the Advantage plans as well. We can help make heads or tails of them, tell you what the co-pays are going to be, tell you what the drug costs are going to be. If you want to, in either case, Part D, Advantage, if you want to sign up for something, disenroll in something, switch around, open enrollment's the time to do it, and we can help you with it. We can do it so you're not dealing with the the insurance companies directly. Glad to do it. I think that's all I need to say on that right now. They talk a little about moving between options, but I'm actually going to move you to another spot, and we'll talk this way. So, what's the better way to go? Do you think I'm going to answer that? No. It's an individual thing. It's an individual thing. Think about it this way. If I'm over here, I have original A and B, have my Part B premium, right? Depending on how I do it, if I have a Medicare supplement, I have a big payment there, you know, at least $150 probably from my Medicare supplement, and I have a payment for my drug coverage. But what am I getting for that? Not a lot of bills. My supplement's going to pick up just about everything Medicare didn't. So I'll have some co-pays on my drugs and things like that, but that's about it. I also have an open network. I can go, you know, wherever I want all over the country, you know. Fantastic coverage if you're one of those people who's going to buy an RV and travel around, right? Great coverage for that. Other way around, Medicare Advantage. Relatively less money. Still pay my Part B premium, might have a premium on top of that. Not paying quite as much out, but I'm having co-pays as I use it. I'm paying as I go. I also have that network, you know. Depending on the type of plan I have, I might have to stay in network. It's always a good idea to keep up on the network. You're with me so far, right? I haven't yet told you what's the best way, and I'm not going to. It's an individual thing. It's kind of up to you. But here's the next thing to think about, which is what the slide I just bypassed, was the moving between options. Think about this. I can always go from option 1 to option 2. I can always pick up a Medicare Advantage unless I have end-stage renal disease. I can always go from option 1 to option 2. I can always go from a Medicare Advantage to another Medicare Advantage. I can always, switch between companies there. I can always go from a Medicare Advantage back to original Medicare and pick up a Part D. Can always do that. There's one wild card in there. That's the supplemental plan. 100% private, right? 100% private. I can't always necessarily go back and pick one up. Because once I'm outside of that guaranteed issue period, I can apply, but they're going to do that medical underwriting. They want to know my health history. And like I said, they can refuse me at that point. I cannot necessarily always go back and pick one up. Everything else I can always move around except for that one little piece. So it's one of those things, though, particularly the number of people who shot their hands up when I asked who was not yet on Medicare. It's one of those things definitely to educate yourself on right now. Definitely, find out about it right now. That's what we're here to help you out with. We'll help you out, but we can't make those final decisions for you. As I always like to say, if you could predict the future, you could put the insurance companies out of business. But you almost have to decide right now how sick you want to be for the rest of your life. We can't do that, can we? Hopefully I made a little bit of sense of that. I got one more slide I want to get through, which is protecting yourself from unscrupulous sales practices. Is that the last page in the new book? Yes. How to prevent Medicare sales fraud. Same difference. All right. What's coming up? Medicare open enrollment. Starting October 1st, the plans can start marketing to you for next year. And that means not just who you're already doing business with, that means everybody under the sun is going to start sending you ads in the mail. They're going to have ads on TV, on the radio. They're going to have infomercials. And then you're going to get some pesky phone calls as well. As a matter of fact, there's even a guy who sets up at the Kroger by me in a table. All that stuff's okay. Most insurance agents, most insurance companies, most insurance agents are good people trying to do the right thing for their clients. That's the only way you really stay in business long term. But we all know there are a lot of people who break the rules, and there's a lot of crooks and scam artists, right? Here's some things you gotta know that they cannot do. Insurance salesmen cannot do door-to-door sales. No one should be showing up at your house unless you made an appointment with them. You guys probably think, well, that never happens. We get complaints all the time. Senior apartment, senior buildings where people have to punch in a code or something. That's a real hot spot for these guys. They'll get in, have an appointment with one person. So, everybody else here I know is over 65. I'm going to go hang out in the cafeteria, the commons area, see who I run into. It's against the law. Believe it or not, we've had a lot of complaints recently, actually out in some of the farms. I don't know who's running around farms knocking on doors, but there's somebody doing it. Giving out cash gifts or gifts exceeding $15. You have an appointment with an insurance agent. They might have, a giveaway item. The hot thing now is they seem to give away gas cards a lot. Come to this presentation and you'll get a $10 gas card or something like that. That's fine. They can't give you cash. They can't give you anything worth more than $15. So when they say if you sign up, we're going to put you in a drawing for a cruise, they're lying, and it's against the law. Now, I'm sure there's no cruise. Also, good to know that if you have an appointment with an insurance agent or even go to a seminar, if they have one of those giveaway items, if you ask for that item, by law, they have to give it to you. So you're within your rights to say, I don't want your crummy plan, but I want the gas card because I used my gas to get here and I'm using my gas to get home. That's fine. You're within your rights to do that. High pressure sales tactics. The scope of insurance sale should be they come to your house or you go to their meeting, their office, whatever it is. They're going to tell you why their plan is the best thing ever. And you're going to say, sign me up, no thank you, or let me think about it and I'll call you back. Most of us say that, right? They can't stay and try to pressure you to sell, to buy, I should say. What we get a lot is, me and Bill and Dennis, we drove all the way up here from Columbus, and Bill and I have small children, and boy, it'd be really great if I could get you to sign tonight, so that we don't have to come all the way back up here next week. If we could just wrap this up right now, it would really be helping me out. That's totally illegal what I just said. You know, it sounds like I'm just a dad trying to appeal to her better nature. I'm not. I'm trying to pressure her to sign up for something that she's not ready to do yet. Because most of us do want to think about that for a little while, go over that paperwork a few times, right? What am I signing up for? Absolutely illegal. Misrepresenting the plan, obviously, and the big one there is representing themselves as Medicare. I am here to tell you folks, Medicare is not calling you. Nobody from Medicare is giving you a phone call. They are not sending you an email that you have to click on, respond to in any way, and they sure as heck are not sending an actual live person out to your house. It's not going to happen. If Medicare needs to talk to you, they will send you a letter through the old-fashioned postal service with instructions to call them. That's it. When you get that call and it's Bob from Medicare, it is not Bob from Medicare. The best it can be is someone trying to sell something, being deceptive, lying to you about it. That's the best case scenario. More likely scenario is someone trying to steal your identity. They're trying to steal your information. They want your name. Your Medicare card is either your social security number or your spouse's, depending on how you qualify for it, right? And then they can go and do all sorts of things in your name. They can take out loans, take out credit cards, all sorts of good stuff. What we always say is don't give that number out on any phone call you did not make. So if you call us, yes, we're going to ask for it. If you call Social Security, they're going to ask for it. But we're not going to call you. We're not going to call you and ask for it. So guard that number the way you would anything else. Hey, that takes me to the end. Awesome. What I always say is if you did not listen to a wait, we're not done. If you didn't listen to a word I said, or if by dinner tonight you're going to forget 90% of what I said, and you're going to toss this, hold on to the back cover. The most important page in the whole book. Reference information for you. It is, the top one is us again, Department of Insurance, 7:35 Monday through Friday. Give us a call. Absolutely glad to help you out. Next one, there's 1-800-MEDICARE. They are 24/7. Be aware, however, we share that with the entire United States. Another way to look at it, you share it with 55 million of your fellow Americans on Medicare. And the most recent stat I heard is in this country, every 6 seconds somebody turns 65. So my advice, if you have to call 1-800-MEDICARE, earlier the better. If you can get that first cup of coffee and call them, it's probably the best time. Right now is 3 o'clock Eastern Standard Time. Not a great time to be trying to get through on Medicare. Early is better, or super late. Bill's a night out. He stays up till the middle of the night sometimes. That's a great time to call. If you're up at 2 a.m., that is a fantastic time to get through. When my kids were babies, I tried it out, and I can tell you it is a fantastic time to get through. Pro Seniors is who Barb, who did run out, was with. Gave you all that good red stuff. And the last one I want to mention is Social Security. That is, again, a federal hotline for Social Security, 1-800-772-1213. But you can make an appointment at a local office. You can absolutely make an appointment at a local office. All the rest of these are different agencies. You see Medicaid, labor, veterans, all that good stuff. None of these are for-profit businesses. None of these are anyone trying to sell you or push you into anything. Just there for you. So that now you can clap. Are there any questions I can answer for you guys? Yes, sir.
Back when you were talking about being in the hospital, not admitted but for observation.
Yeah.
Can you refuse to go in for observation because then you got to pay for it?
Well, okay. His question was, can I refuse observation status? Well, here's the deal. It is still covered. Observation status is still covered under your Part B, because that's an outpatient service. What I said was the observation is not going to count towards the 3 nights you need to go to skilled nursing.
Okay.
Can you refuse to be an observation? Yeah. But they'll send you home, and they'll say that you refuse treatment. And then you're going to get a bill for having them checking you into the ER in the first darn place. It's the same thing if you go to the ER and they register you, and you're like, man, I've been sitting here too long, I'm done with this, I'm going home, you're going to get a bill for that. Because once they register you, you are on the books.
So if you're in observation, they're going to pay for it?
Part B will cover it. Keep in mind, Part B is an 80-20.
Yeah, but you have
Yes.
to pay something on it.
Correct. Part B is an 80-20.
But then you get that 100, you go in there for one day, and then the $161, you paid that? You paid 160 of the 161?
Not quite. If I'm in there under observation status, that's not being paid by my Medicare Part A. It's being paid by my Medicare Part B. And my Part B is an 80-20, meaning Medicare pays 80%, you're stuck with that remaining 20. But if I have a supplemental plan or something like that, it's gonna pick up the rest of that. It's gonna pick up the rest of that. Where it gets sticky is that I need to be inpatient in the hospital for 3 overnights for Medicare to pay for that skilled nursing stay. And if I'm in observation status, anytime I'm in observation status, doesn't count towards that. That's the sticking point with observation. Does that kind of make sense?
Yeah, but where's the 100, when you go into the nursing care after the observation,
Sure, okay.
then,
That 161, you mean?
right.
Okay, that's gonna be, that's if I just have A and B. I don't have a supplement, I don't have Advantage. The first 20 days I'm in skilled nursing, I don't have a copay. Starting at day 21, I have a daily copay. Daily copay of 161 a day. Which sounds like a lot, but skilled care is around $700 a day. So 161's just, it really is just your copay. But if you have a supplement plan, it's gonna pick that up. If you have an Advantage plan, it's gonna be a whole different schedule because of the copays. I know, I just confused you even more. I can see it.
Because I've heard these stories about if you're in for observation,
Yeah.
they don't pay, so you can refuse to go to that.
With Medicare, Medicare's still gonna pay. Now, that doesn't speak for all insurance, however, keep that in mind. You know, like I have insurance through the state of Ohio. I don't know how that works with observation, I hope I don't find out, you know. Yes, ma'am?
Is there a fee for me with the volunteer?
Absolutely not. Actually, I can answer that 2 different ways. She said, is there any fee for any of OSHIIP's services? There's 2 different ways to think of it. No, there's no fee. Or OSHIIP is taxpayer supported, so you already paid it. 2 ways to look at it. And we're funded through the federal government, so of course, who's that mean? It means we're the ones paying it, right? I'm gonna get her and I'll get you. Go ahead.
Okay, I'm still a little bit confused about the prescription part of it.
Sure.
Turning in 65.
Uh-huh.
And, do I have to go to the Social Security office and sign up for their plan if I decide to go red, white, and blue?
Okay.
Or-
So if you're going red, white, and blue, original A and B,
Yes,
and as I said, if you're already getting a benefit from Social Security,
yes,
they're gonna sign you up for A and B.
yeah.
But to sign up for the drug plan, you're actually gonna have to take action to do that. You don't have to do it through Social Security, no. Because you can do it through OSHIIP, you can actually do it online yourself if you want to.
Okay,
You can actually go online yourself and do it as well.
okay,
But you started out by telling me you were confused, so I'm gonna tell you to call us.
okay. I will tomorrow.
Okay, awesome. Yes, ma'am.
I'm still working.
Okay.
My husband's under my plan.
Yep.
Now, when he gets on there, I have a high deductible.
Mhm.
Is that one of them that they say is covered, is compatible with Medicare?
Sure. Her question was, if you didn't hear, she's still working, he's retired. She has a high deductible plan. She's wondering, is it credible coverage to Medicare? And either your benefits manager at work or the employer itself should be able to send you something in writing that tells you whether or not it is. And they actually legally send it out every year, but you might not see it because it's going to come in like that big benefit book. It's like 30 pages, and it's a little statement in there somewhere. But call them and ask. Send me something in writing that says that. Some employers, however, and I don't know, some employers, when someone on the plan is turning 65, they will get a letter saying, hey, here's how this is going to change for you now that you're turning 65, or here's how this is going to change for your spouse now that he's turning 65. And so we'll see.
So I need
See
to
what
look
happens.
into it.
So yes,
Yeah.
because each employer plan's a little different. Anything else, guys? Yes.
If you're on a supplement and during open enrollment, you're checking and you want to change supplements, does that or do they have to check your medical records then, like you were talking about?
Oh, how do they do that medical history? Is that what you want to know?
Yeah, I mean, will you get charged more? Like if you're on a
Yes.
supplement and you're looking at other supplements?
Yes.
If you change,
Her question is, if I'm on one supplement plan I'm gonna go top of the alphabet, okay? You said Anthem, that's pretty close. But let's say I'm on AARP, and I wanna get rid of it for whatever reason. Premium's going up, and I wanna look at Aetna. Just doing alphabetically here, I'm not picking on anybody. Is Aetna gonna do the medical underwriting on me? Absolutely.
So you could
Because
have.
I'm going from private company to private company.
So you could have a
Aetna
higher.
doesn't know who the heck I am, and they don't care that I've been with AARP for the last 5 years.
So you could end up with a higher.
Yes.
Premium than you had
My
originally.
general advice for that is if I have a supplement plan, feel free to shop around at any time. But don't drop your old plan until you're accepted in the new one. Does that make sense?
Yeah.
You know, hold on to that old one until I am sure that new one's got me. And by sure, I need to have it in writing. Yes, ma'am.
There also is pre-existing conditions with that as well.
Some of them plans do. Some do and some do not. Some do and some do not. And actually, the guide you have would actually have that in there. The purple colored one there, purple and blue. They actually, when they have the list, it does say pre-existing. The most they're allowed to do is 6 months. They can't have pre-existing condition longer than 6 months. Some have 3, but a lot have none at all. A lot have none at all. Any other questions, folks? And I will say that I will hang out. If you have questions that you wanted to ask that you didn't really feel like raising your hand and asking in front of everybody, I will be here. The fellas in back, are you sticking around for a little bit, Janice, or are you running?
Yeah.
Okay, Janice in the green shirt. But other than that, I thank you guys for your time. If you have a question, come on up. But other than that, thanks again.
Thanks again for everyone coming out.
Yeah, you sat right in front. Good work. Okay. Yes.
I paid Well, that's where I can clear on that. So that'd be $400. Yeah.
Okay.
It's a PPO. Yeah, she. Yeah, he's got a whole different.